Okay, hello everybody. Thank you for joining us today. We're going to get started because it is 1 o'clock and we have a jam-packed schedule today for this webinar. I just want to thank you again for joining us for this webinar presented to you by the National Collaborating Center for Methods and Tools. My name is Claire Howard. I'm a research coordinator at the National Collaborating Center for Methods and Tools. So just before we begin, we have a few housekeeping items. Please use the chat box to send your questions and make sure to send questions to all participants, so not just privately to the host. There will be several question and answer opportunities throughout the webinar today, but please send your questions in the chat box at any point during the presentations and we'll make sure to get to them during those question and answer opportunities. We also recommend using a wired internet connection today. If you do encounter any technical issues, the phone number for the WebEx 24/7 helpline is on the slide. And under panelists, you will also see Kate Turner. She is a research assistant here, and she will be helping to support the webinar today. If you have any technical issues or other tech or support questions, you can contact Kate. So the slides from today's webinar will be available online in both English and French, and they'll be available approximately 2 weeks after the webinar. A recording of today's webinar will also be available, but it will be in English only, and it will be posted online as well. You can see the link on the slide there, and it should show up in the chat box as well. We will also be posting links to the slides and recordings on our social media accounts, so that's Twitter, LinkedIn, and Facebook. We're just going to start with a quick poll today to get a sense of how many people are joining us today. So how many people are watching today's session with you? A, just me, B, 1 to 3, C, 4 to 5, D, 6 to 10, and E, more than 10. So it looks like most people joining us today are on their own, which is fantastic. Thank you for joining us. And we will move on to the next slide now. So thank you again for joining us for the first webinar in the peer-to-peer webinar series this fall. We did host this webinar series last fall when the first issue of our evidence-informed decision-making casebook launched, and we are happy to be bringing the series back again this year. This webinar series is designed to share success stories of evidence use or building capacity for evidence use in public health practice in the real world, and it will help demonstrate that EIDM is achievable for anyone working in public health. So there are 6 national collaborating centers located across Canada, and the National Collaborating Center for Methods and Tools, or NCCMT, is one of these 6 national collaborating centers. Each national collaborating center does focus on a different public health priority topic area. The NCCMT is located in Hamilton, Ontario, and our mission is to enhance public health practice and policy in Canada by providing leadership and expertise in evidence-informed decision-making to Canadian public health organizations. To support our mission, the NCCMT offers many products and services through our website to help build capacity and apply evidence-informed decision-making. So we have the Registry of Methods and Tools, which is a collection of over 270 methods and tools for knowledge translation and public health. We also offer many online learning opportunities, and I encourage you to visit our website to explore these opportunities. One example of one of these opportunities is our online learning modules. So we have 13 online learning modules that build skills for evidence-informed decision-making in topics such as searching for literature, critical appraisals, as well as implementing and evaluating knowledge translation strategies. We also offer workshops. So if you are interested in the workshop, please don't hesitate to contact us. We have Public Health Plus, which is a repository of high-quality pre-appraised studies and reviews relevant to public health. There are several video series available on our website, including the popular Understanding Research Evidence series, which goes through concepts important to evidence-informed decision-making. And we also do networking and outreach opportunities. And part of these opportunities is attending conferences. So please, if you see us at a conference, stop by our booth and come and say hi. So today's webinar will feature stories from the second issue of the Evidence-Informed Decision-Making Casebook. Issue 2 launched at the beginning of October, and a link to the casebook should be posted in the chat. And if you have not already done so, I encourage you to look through the casebook and read the author's stories. They're all very fantastic and help explain how public health practitioners have used evidence in their practice. So our first presentation today comes from Kristen Beaton at Huron County Health Unit, and I will pass it over to her to further explain her presentation.
Okay, great. Thank you. This is my first time presenting on a webinar, so I just get used to, okay, I can turn the page, that's perfect. So good afternoon, everyone. My name is Kristen Beaton, and I'm a program evaluator at the Huron County Health Unit, which is located on the west coast of Ontario on Lake Huron, about an hour north of London. And today I'm going to be sharing with you my experience with conducting an internal evaluative thinking communications campaign at our organization with an aim of contributing to an organizational culture that supports evidence-informed decision-making and evaluation. So before I get into the details of my campaign, I want first to do a brief introduction as to what I mean by evaluative thinking and how it relates to evidence-informed decision-making. Evaluative thinking is a relatively new term in the field of evaluation. The most commonly cited definition is this: evaluative thinking is critical thinking applied in the context of evaluation, motivated by an attitude of inquisitiveness and a belief in the value of evidence. The points that I pull out of this definition are that evaluative thinking involves both the skills of critical thinking, but also, in order to be applied, it requires a certain set of attitudes and beliefs in the user. It seems to me that the same set of attitudes and beliefs also form a foundation for evidence-informed decision-making. The one drawback I see in this definition is that it limits evaluative thinking application to only the context of an evaluation, which can exclude those who do not see formal evaluation as a part of their work. For this reason, I add on this definition from Michael Quinn Patton that evaluative thinking is a way of doing business, which broadens the concept so that it's applicable to everyone. I see this as particularly applicable working in a context of a busy local health unit where most staff are too busy with their own work to engage in any formal evaluation activities. Evaluative thinking is a tool and skill that can help incorporate more evidence-informed decision-making into everyday work. For a bit of background, this project stemmed from the Evaluation Capacity Building Locally Driven Collaborative Project, which was funded by Public Health Ontario and ended in 2016. The first phase of the project involved assessing evaluation capacity in Ontario public health units and a scoping review to determine the factors that contribute to evaluation capacity building in public health. The second phase involved 10 action research projects to test strategies to build evaluation capacity in different organizations. And this campaign was one of those 10 projects. When I was contemplating the strategy to trial as a part of the planning of this action research project, the idea for an evaluative thinking campaign also actually came out of frustration, where I was asking myself questions like, how am I supposed to build evaluation capacity when nobody has time to work with me to do an evaluation? Or how can I build organizational support for evaluation when our organization is undergoing so much change? At that point, we were in the early stages of amalgamation talks with a neighboring health unit. So I actually stumbled upon the concept of evaluative thinking on an evaluation blog, and it seemed to provide a solution to my problem of limited time to work with staff and poor timing for making any large organizational changes. The project itself aimed to build staff awareness of evaluative thinking, and this was mostly an entirely new concept to everyone, to shift attitudes by increasing the value placed on evaluative thinking and on evaluation more generally, as well as to build staff skills to think evaluatively. The thought was that this was an initial step in a broader strategy to try to shift the organizational culture towards a learning culture. From the planning phases of the campaign, I wanted to be sure that I was walking the walk by incorporating the best possible evidence into the campaign design. This was actually my first time ever designing a communications campaign, and I definitely took an evaluator's approach to the design of probably trying to seek too much information for each step in the program decisions. A survey instrument called the Evaluative Thinking Inventory was used to survey all staff to get a baseline level of what evaluative thinking looked like in the organization. I also convened an internal advisory committee that consisted of a communications coordinator, my manager, and a health promoter with interest in the topic. They gave me feedback on staff preferences for receiving information, what they thought would go over well with staff, as well as guidance on how to design and build a communications campaign. I also had some data from evaluations of previous internal communications campaigns to help make decisions around methods of delivery. The findings from the scoping review of the Evaluation Capacity Building, LDCP, were also incorporated into the strategy, in addition with the limited literature on evaluative thinking that was available at the time, which was in 2016. Some evaluative thinking capacity building work had been done at different organizations, like the Cornell Office for Research on Evaluation, and in development work through Catholic Relief Services. So I drew heavily on some of their published gray literature to draw campaign ideas and direction. In terms of resources, this campaign was basically implemented with very limited resources. I had a $300 budget, 8 months from planning to delivery and evaluation, and then some in-kind support from internal staff for design and communications. I was the staff lead on the project, and at the time I was also the solo evaluator in the organization and still responsible for doing the rest of my job. So this really was a off the side of the desk kind of project. I will say that in the last 2 years since I planned and implemented this project, the amount of literature and resources available in evaluative thinking has exploded. There's even a hashtag on Twitter now, evaluative thinking, and this summer the entire summer edition of New Directions for Evaluation journal was dedicated entirely to the topic of evaluative thinking. I was also able to take a workshop on evaluative thinking capacity building this summer with the American Evaluation Association. So my challenge this year is to try to incorporate some of this new evidence into the planning of this year's campaign. Here's a really basic program logic model I put together to illustrate the campaign. The aims of the campaign were really first to make staff aware of evaluative thinking, next to support staff to value evaluative thinking and by extension evaluation more generally, and then to build skills to use evaluative thinking in their everyday work. The hope was that in combination with adding organizational supports for evaluative thinking, like meeting time that's dedicated to evaluative thinking and opportunities for supportive critical peer review, that evaluative thinking would start to be used more often, and ultimately the goal was to build a learning culture. And I just want to make sure that it's noted that this program logic model is really oversimplified, and I haven't illustrated that there's obviously many, many other factors that would also need to contribute to building a learning organization culture. So now this is the fun part, to look at the actual campaign and what was delivered. So with my advisory committee, I developed 3 key messages for the campaign. First, evaluative thinking is critical, actionable, and happens anytime. Next, evaluative thinking can help improve our programs, services, and culture. And the third is it's easy to add more evaluative thinking into your everyday work. So basically, it's what is evaluative thinking, why is it important, and then reassurance that it's not an extra workload burden. But I'll say as a spoiler alert for later evaluation results that while the use of evaluative thinking in itself isn't extra work, there does need to be upfront investment of time to learn about it and practice the skills of thinking evaluatively. So that third key message maybe was a little bit of a stretch. So a main part of the campaign was the branding. Our graphic designer designed this awesome logo and tagline and also helped me brand all of the campaign materials with the correct colors, fonts, and logo. And I use this logo in my email signature to this day because I think it's really great. Another fun part of the campaign was where I worked with the evaluation blogger and cartoonist Chris Lacey to develop 2 cartoons to illustrate the concept of evaluative thinking. This first cartoon illustrates some of the types of questions that could be asked when evaluative thinking is being used. Like, how do we know? How can we do this better? Did we get their feedback? Are we wrong? But where is the evidence? This next cartoon illustrates the idea that evaluative thinking is not the exclusive domain of evaluators and that everyone can use evaluative thinking in their everyday work. With permission, I was also able to use some of the other cartoons from the Fresh Spectrum blog as a part of the campaign. And unfortunately, I wanted to share it, but the blog is no longer live. The main communication vehicle for the campaign was the Think Evaluatively blog on our intranet. And our intranet is cleverly named WAVE, which stands for Ways to Access Virtually Everything. So when I refer to WAVE, that's what I mean is our Huron County Health Unit intranet. I published a blog post 1 to 2 times a week during the campaign and advertised the posts on our intranet homepage. The posts were short and meant to entice staff to be interested and curious about the topic. Some of the posts were pre-planned, and others were reactions to things that I'd seen or articles that I'd read. I do continue to occasionally use this blog to share evaluative thinking topics I think might be relevant to staff. And the real purpose of the blog was to drive staff towards the more in-depth content on evaluative thinking that was contained in our static evaluative thinking pages on the intranet, which is what I have a screenshot of here. The evaluative thinking content pages are also housed on WAVE and have more in-depth learning on what is evaluative thinking, why does it matter, and how can it be used. I also had sub-pages on the role of assumptions in evaluative thinking, what evaluative thinking looks like in practice at an organizational level, as well as for individual professional development. My favorite component of the campaign, and where I thought staff really started to become engaged with the concept of evaluative thinking, were the evaluative thinking workshops. And pictured here, you can see a very, very pregnant me facilitating the cookie experiment workshop with staff in the lunchroom. This first workshop was an introduction to the concept of evaluative thinking and was a kickoff for the campaign. It was surprisingly well received, and I ended up scheduling a second workshop for those that weren't able to attend. And for the second one, we used popcorn instead of cookies just to mix it up a bit. Throughout the month, I facilitated 2 different hour-long workshops. One was on the 6 thinking hats technique, and the other was on how to be a critical friend. And that workshop used the concept of speed dating to practice being a critical friend with different people in the room. I also was able to get on the agenda for most team meetings that month, and I would go to the meeting to either facilitate a bit of a discussion on the Gibbs reflective practice cycle as it relates to evaluative thinking, or to facilitate a discussion on the Paradigms Exposed quiz, which helps you to determine kind of what your worldview is and how it affects the way you approach evaluation or inquiry. Many of the activities in the workshops came out of this book by Preskill and Russ Eft that was distributed to all participants in the Evaluation Capacity Building LDCP, and that I would really recommend to anybody who's looking at doing any sort of capacity building work in their organization. Following the campaign, I developed Howto Guides for each of the workshop activities that I had conducted and posted these also on WAVE. The idea was that staff could take those and facilitate the activity with their own teams or with other community groups or partners that they work with. I have heard of a couple of instances where people have actually done this, although I don't think the uptake has been as great as I'd hoped, and maybe not worth all of the work it took to put those guides together. An ongoing component throughout the month was the Evaluative Thinking Bingo. Each square was either a task for the bingo player to complete, for example, go read the blog or attend a workshop, or it was an observation that they were to make about observing evaluative thinking in others. For example, one of the squares is if you hear a colleague ask, how could we do this better? Then you get to check off your bingo square. At the end of the month, there was a draw for all participants in the bingo for a small prize. So being an evaluator, of course, I had to evaluate the impact of the campaign, and it was also a requirement of the participation as an action research project with the locally driven collaborative project. The Evaluative Thinking Inventory was administered pre- and post-campaign, and staff were asked about their participation in the various activities in the post-campaign survey. I also had analytics from the intranet and participation numbers from each of the activities. Overall, the reach of the campaign was quite good, with 94% of staff who responded to the follow-up survey indicating that they participated in the campaign in some way. 89% of survey respondents participated in at least one workshop, and 41% completed the bingo card. And just as an aside, I had a 70% response rate to the follow-up survey, and even if I assume that everybody who didn't respond didn't participate in the campaign at all, we would have a participation rate of about 66%, which I think is still pretty good for the entire staff for the whole organization. And in an organization with about 65 full-time equivalent staff, we had 277 intranet site visits, which is specifically for our Evaluative Thinking site, and 255 blog visits. There were 17 comments on the blog posts, which was actually one of the bingo card tasks, to add a comment to the blog. And the comments didn't generate as much good discussion as I'd hoped, but there was sometimes a few back and forth responses between staff, often me going in there and trying to facilitate that. The Evaluative Thinking Inventory results showed that the campaign did successfully increase staff understanding of and their perception of the value of evaluative thinking, which looking back isn't that surprising since it was a completely new concept to almost everybody. So the increase in working knowledge of evaluative thinking went from 69% pre to 89% post-campaign, according to the Evaluative Thinking Inventory. And of all of the dimensions in the inventory, 8 of the 13 that were related to skills showed an increase, and 5 of 6 that were related to values showed an increase. And one of the evaluative thinking dimensions with the greatest increase was actually, I seek evidence for claims and hypotheses, which again directly relates back to evidence-informed decision-making. The follow-up survey also asked staff in their own words to describe their take-home messages from the campaign. And the most common one ended up being the message of that you need to take different perspectives, which I thought was interesting because it came directly out of the 6 Thinking Hats workshop and really wasn't mentioned at all in any of the other campaign materials. So I think that really reflected the interest that staff had in that activity and that they remembered that workshop more than anything else. The other messages identified were that you need evidence to inform action, which is really in line with, again, evidence-informed decision-making, as well as the idea of asking tough questions being important and valuable. So while these weren't exactly aligned with our original intended key messages, they weren't completely off either. I also conducted interviews with managers post-campaign to get their impressions of the campaign and whether they thought that their staff was actually incorporating this into their work. And managers did think that the campaign had brought visibility to what is already being done by staff, and noticed that evaluative thinking had become a new part of staff vocabulary. And one interesting thing about it being bringing visibility to what's already being done is that in some cases there might have been on a team 1 or 2 staff that were asking tough questions and maybe providing more critical feedback that wasn't necessarily well received, but this campaign provided a bit of a background as to why that kind of thinking can be actually valuable and can be helpful, and provided a bit more opportunity for acceptance of that kind of questioning. There was also some good, I would say, critical friend feedback from those interviews that the campaign really needed some more tangible tools and skills that for staff to take out of it, and that more work needed to be put in towards shifting the organizational culture. And obviously, you can't change a whole culture with a 4-week campaign. And one unintended outcome from the campaign actually happened while I was away on parental leave last year. And our new strategic plan was developed, and one of the organizational strategic approaches was to support a culture of evaluative thinking. And I'd like to think that maybe this campaign planted a seed that might have led to that approach becoming a part of the strategic plan. If nothing else, I think the campaign definitely provided the vocabulary for the term evaluative thinking to be used in that document. So some key success factors with this campaign. The main one, I think, was the external pressure to get the project done. Things get busy, and it's easy for this type of work to take a back seat. And for this campaign, we had the external pressure from the Evaluation Capacity Building, LDCP, that provided a framework and provided deadlines for the project, as well as support from the rest of the research team. Strong management support was imperative for the success of this campaign. Managers encouraged their staff to participate in the activities and allowed staff time to participate in the workshops. The intranet, WAVE, provided a place to house and advertise campaign materials, and also was an easy way to communicate with all staff across the organization. And another success factor that I call go with the flow is that I think one of the major reasons why this campaign had success was that I was essentially jumping into a river that was already flowing in the direction I wanted to go. With the redevelopment of the Ontario Public Health Standards, an increased focus on accountability and evidence-informed decision-making, this kind of thinking aligned really well with evaluative thinking, so I wasn't challenging any of the messages coming from other sources. Some of the key lessons learned are that, as always, workload continues to be a barrier. Even when staff were interested and engaged, they didn't always have the time to be able to participate in some of the campaign activities. Another key learning was that I needed to provide more examples that were more applicable for different roles within public health, from inspectors to support staff, public health nurses, health promoters, that I needed to provide more specific examples of how this kind of thinking could be used in everyday work. And again, I've mentioned this throughout the presentation, but the idea that culture change doesn't happen overnight, and that there's a lot of other factors, and that any sort of communications efforts are only one small part. So as I showed earlier, supporting a culture of evaluative thinking was identified as one of the strategic approaches in our strategic plan. So this does continue to be a priority for the organization. So my next step is planning a campaign again for this year, for 2018. This year, Evaluative Thinking Month is going to be November. And I've been working with, we have a second evaluator now at our organization. So we've been working together to develop some new workshops on how to ask good questions, how to align questions and methods, on alternative explanations, and how to form a good argument. We're also going to try a giant living logic model in the front foyer and a fail-fest lunch and learn presentation with stories of failures and lessons learned from each of our managers. Also, in collaboration with some other evaluation colleagues from Ontario Public Health Evaluation Network, we submitted an evaluative thinking workshop abstract to the Ontario Public Health Conference for 2019. So hopefully that will get accepted and we'll get to share this work more broadly. And evaluative thinking as a concept seems to be developing at a rate faster than I'm able to keep up with, but I'm trying my best to continue to incorporate this new evidence into the planning process and future action on this topic. So thank you for your time this afternoon, and I welcome any questions.
Great. Thank you, Kristen, for your presentation. So we do have some time now for Q&A. If you have any questions, please feel free to send them in the chat box, and remember to send to all participants. While we wait for some questions to come in, I do have a question. So you mentioned a number of different tools that were used, from workshops to those cartoons and other activities. Is there, in the blogs as well, is there one that you thought worked more than the other, or were they all really like worked together and can't really be separated out like that?
I really felt that the workshops themselves were the method that seemed to, I guess, work best, got people engaged, although part of that might be that because I was facilitating the workshops, I actually got to talk to people, engage with people, whereas the other campaign components are very hands-off. So I'm not sure, what people were thinking or chatting about if they were reading the blog or engaging with the other campaign components. But the workshops seemed like where the concepts really started to come to life and people started to understand how it's actually applicable in their own work. And I got some really great questions in those workshops as well that helped me to again, form future, like redevelop the workshops and try to improve them in the future as well.
Great, thank you. And I just have another question. So you have some quotes in there from some managers at your health unit. And we know that organizational change can be really hard to do and for some people as well. What were the perceptions of other staff around this, trying to shift the organizational culture?
Well, again, I think that I was kind of just jumping into something that was already happening, that over the last, 5 years, that we've been starting to see this shift in culture towards, I guess, more openness and more where people feel like they're able to give more feedback and highlight those areas where things might not have gone as well and how lessons learned sort of thing. I think that's a big part of the organizational culture, and a lot of that comes from leadership, I think, is a really important part of that. And I mean, that was nothing that was controlled by this campaign, but I think that it kind of was jumping in on something that was already happening.
Great, thank you. So we do have some time at the end of our next presentation as well for an open Q&A. So if anybody out there has any questions that they think of, please feel free to send it through the chat box to all participants, and we can answer it at that time as well. Kristen, can I just ask that you pass the little ball back to me? Okay, perfect. So our next presentation comes from Dr. Ebeli Mogo and Dr. Keiko Shikako Thomas, and they did some work on using a policy dialogue. So I will pass it over to them now to further explain about this work.
Hello, everyone. Pleasure to be here talking to you today. This is Keiko Shikako Thomas. And we'll be sharing the presentation with Ebeli, who is a postdoctoral fellow at my research lab. I'm an assistant professor at McGill School of Physical and Occupational Therapy. And we're going to present to you the results of a project, which was a stakeholder dialogue, a policy dialogue in childhood disabilities. And we are going to reflect a bit on how we use that dialogue project, which is part of a dialogue series to test different integrated knowledge translation processes, and with a special focus on improving participation for children with disabilities. This one specifically reporting the case of the dialogue we did in British Columbia. So next, Adele. The different members of the research team quickly. So Abali, as I mentioned, is a postdoctoral researcher at my lab. I am a Canada Research Chair in Childhood Disabilities. Annette Maynemer and Jonathan Lay were also researchers involved in this project. So it's a great team around that. To give you a little bit of a background on how this project was set up, we know that around 4.6 of Canadian children and youth have an identified disability, and that includes all types of physical, sensory, different types of disabilities. In British Columbia alone, 15% of the population has an identified disability. We know from previous research that children with disabilities in Canada specifically, but also in other parts of the world, they face major systemic challenges to participate, and especially to participate in physical activities, which is a public health concern, especially given the benefits and the potential health and developmental outcomes that are related to participation in physical activities. We know from previous research that some of the key barriers to participation include structural barriers, so lack of accessibility of public spaces, lack of programming tailored at children with disabilities, lack of access to information, so coordination of information on where children can participate, where they can go, where the adequate resources and supports are, and also attitudes from the public at large, but especially from service providers at the community level in relation to disabilities. And that is one of those are a few of the factors that make children participate less than the same age peers. So there are some solutions that are also identified in research, and the research, though, usually it's only available and circulates. This is a research that circulates a lot in the healthcare research settings, but does not make necessarily to the public health audience, and does not make out of the academic settings. So we know that knowledge translation strategies are necessary. Next. So we identified a few years back when we did a research identifying those determinants of participation for children with disabilities. We did a series of forums in different communities, so in Montreal, in Toronto, Calgary, and Vancouver, with a large group of stakeholders, a variety of stakeholders. And each group identified priorities or strategies to actual impact participation of children with disabilities, so actions that could be taken either at the research level, the community level, at the healthcare provision levels to impact participation for children with disabilities, and to make sure that the research information was reaching the populations, the end users that could use this information to affect changes. So we did, after the series of forums, one of the priorities that was identified in BC, particularly in the Vancouver forum, was establishing a policy dialogue or a policy table, as stakeholders perceived that it was a lot of decision-making level who were not aware of this information and who needed to have a better coordination of information and programs and resources to be able to promote participation for children. So we saw this as an opportunity to improve the methods for engaging community and research partners in discussing evidence-based solutions related to promotion of leisure for children with disabilities. We also strategized and wanted to identify more systematic ways to convey research information to the public, to different stakeholders, and especially to tailor this information in a way that would be actionable for decision makers, for policy makers at different levels, and and we wanted to test some specific knowledge translation to policy interventions using the policy dialogues model. Next. So the initiative then that we are reporting on for you today is how we used a policy dialogue to bridge the evidence to policy gap in childhood disabilities. As I mentioned, this was a first of a series of dialogues that we're now conducting in childhood disabilities. And as such, we wanted to emphasize on the methods development and to make sure we had a clear systematic description of the different steps taken so that we would be able to reproduce that and test different knowledge translation strategies within the policy realm. Next. So the objectives of the policy dialogue were to disseminate the research-based information in leisure participation for children with disabilities to decision makers. And this was both previous information that we had from previous research projects, but also information that was systematically collected and appraised based on the needs of stakeholders, as I will tell you in a minute. Second objective was to inform how researchers could work better with policymakers. So we wanted to also learn from the decision makers which strategies work for them and how we can do a better service as researchers in providing this information. So hopefully contributing to what you heard from in the previous presentation to better critical appraisal of evidence and to be able to work together in connecting those dots between research, academic research, and decision making. And also, a third objective would be to gather stakeholders to discuss strategies that could effectively promote participation for children with disabilities in British Columbia. Next. So, in order to do that, as I mentioned, the whole priority to the impetus to do this dialogue came from a series of community stakeholder forums in different cities. And through that, we learned that the best way to have information from the grassroots conveyed to policymakers was perhaps not to have them together, but rather to listen to the voices of grassroots, to organize the voices of grassroots organizations, and have them sharing their successful strategies and what they have done to promote participation, and then use this information to, in part, to relate to the research information and connect that to the policymakers. So we identified with the grassroots organizations, we listed grassroots organizations first providing leisure services for children with disabilities in BC. We then, with their support, we identified existing policy frameworks, and in that case, the National Recreation Framework was a document, a policy document that was recognized as something that was widely used, widely disseminated, both among grassroots organizations, health service providers, and policymakers, but the organizations also identified some key gaps on this framework, and especially implementation gaps. So they noticed that although the document had clear discussion about the importance of promoting leisure and the needs of this population, there were not specific implementation actionable points within the framework. And then we also worked with the organizations to identify potential policymakers who would be interested and could affect changes at the public health level. So we wanted to identify who are the people making decisions that could influence participation policies and programming for children with disabilities in the province. Based on that opinion on the meeting that we did with stakeholders, so we had a series of teleconferences, of webinars with the different organization groups. And within the National Recreation Framework, we identified points that they felt would be the most relevant or that could have the best impact if implemented. And based on this point, we conduct a systematic rapid review of the research literature and on the topics that they identified, which were inclusion, access, and capacity building. So those are the three topics within the 5 different aspects of the National Recreation Framework that organizations felt were the most pressing and the most relevant in promoting participation. And with that, following the rapid review, we developed a target policy brief, and we asked then the guest list, right, so the policymakers who we had identified, which format of research evidence they preferred, if either qualitative description of the research or a quantitative description, and we sent to them prior to the policy dialogue, we sent the policy briefs on their preferred format. And now I'll pass on to Ballet to continue describing what we did at the actual dialogue.
Awesome. Thank you, Keiko. So we had the actual dialogue in BC, and before this, the policymakers had a chance to review the information in the format that they preferred, whether quantitative or qualitative. And so at the dialogue, we presented the research on what we found around participation of children with disabilities. So we presented we talked again about the policy brief and the evidence that we had found and ways that other organizations or other systems had found to integrate to improve the participation of children with disabilities in leisure activities. So we took examples across the world, what they did, the dosage of these activities, where they were held, what factors helped to make them successful, and what potential outcomes they had. And so after discussing the research that we'd found, we gave participants a chance to also discuss potential implementation considerations. And this was really an opportunity for them to kind of collaborate and build on the collective knowledge to be able to share ideas on how to take the evidence to action in their respective organizations. And so we also try to encourage them to think about solutions, so move it towards an action-oriented conversation and to discuss possible solutions to overcoming barriers to participation. And then in line with this, we presented the Jouer app. So the Jouer app is a listing of inclusive leisure activities across Canada. And in previous consultations, stakeholders had said that a listing like this would be useful. So we discussed the Jouer app as well. And after the dialogue, I wanted to understand people's experiences of the dialogue to kind of build on, to understand how to better engage policymakers and decision makers with research evidence. And so we used a combination of surveys and interviews. And so through the surveys, we found out that it was quite an educated group. So we had 67% of people had a postgraduate degree, 33% had a bachelor's degree, and 93% had experience working with people with disabilities. So a lot of them had experience with people with disabilities. In terms of representation of sectors, we had 34% from the provincial government, and then other sectors like the school board, the municipal government, and non-governmental organizations. And then in terms of the focus area of their sectors, we had a couple of sectors represented. So we had some political leaders, that was about 8%, 25% from nonprofit organizations, 17% from organizations dealing with families and children, 17% from recreation, 8% from education, and 25% from health. So then we followed up with these surveys with more in-depth interviews to understand how people perceive the dialogues, and then to also learn how to better bridge evidence and practice. So these are some of the questions that we asked participants about 1 to 2 weeks after the dialogue. So we asked them about their perceptions of the content of the policy brief, what they thought about the dialogue itself, how they perceived other participants that were in attendance, and then whether or not they thought they could actually use this information to influence policy at the organization. So more about the organizational culture. So now, in terms of the results of the interview, we had a couple of things that came up. We did a thematic analysis of the interview results. And in terms of how people perceived the policy brief, most participants said that they understood the information, so the information was very useful. And in terms of how they wanted to use it, they wanted to use it around content creation and training their own staff. So some people said they would use it to train, for example, the recreational staff. Some of them were going to pull from the evidence to inform policy and to build capacity in their organizations. A lot of them found the policy dialogue, so the event itself, useful for networking. So many people said that they were either planning to collaborate or already collaborating with some people that they met at a dialogue. So it was very useful for networking. Although some people also said that they would have liked more of a focus on actionable policy change at the dialogue itself. And then in terms of how they perceived other participants, they thought that they wanted to collaborate with other participants in the future, and they thought that they had some ideas of how they would want to work together as well. And then in terms of how their efficacy to effect change, it really depended on the person's position in the organization. So whether they were a frontline worker, whether they were a policy decision maker, whether they were a manager, the position in the organization was important, and this influenced their response in terms of their perception of whether or not they could actually take the evidence and change policy. So now we reflected on that in terms of how we can learn from this policy dialogue to inform other efforts to bridge evidence and practice and policy making. So one thing, of course, is that knowledge translation should be active. So there should be opportunities not just to present evidence, but also to make sure that the evidence is integrated with stakeholders' needs and their considerations and their preferences. For example, would they prefer stories or would they prefer more research, quantitative data? We also learned that customer service is a very key part of promoting physical activity participation. And when people don't feel welcomed in, say, recreational centers, for example, they may not come back again. So that there's a key need to improve attitudes of people working in physical activity centers to make sure that people with disabilities feel welcomed if you want to promote participation. And then there were also challenges around capacity and sustaining capacity. One of them was funding, of course, but also staff turnover. The organizations would often have high staff turnover because people were maybe in early stages of their career, and then when they progressed along the line and they had the training, they may move on to other positions. In terms of other barriers to knowledge translation, we had things like, as I said, attitudes of staff, human resources, financial resources, language gaps as well, because you may have newcomers and immigrants, culture and location. For example, if you were looking at rural areas, will most likely not have as much opportunities for participation as you would have in cities. So now we also reflected on, as I said, what kind of things we could learn to build on, to use in other opportunities for knowledge translation. And one of these was just ensuring that more marginalized voices are included in more policy dialogue. So we have people from, say, rural communities, indigenous stakeholders, people with disabilities. And one opportunity to do this is to think about what kind of incentives may allow greater representation of these communities. One of these things might be incentivizing their transport, for example, and reimbursing transport. And we did that for the policy dialogue. And just there's room to think about how to improve the representation of people from underrepresented communities at dialogues like this. Another consideration is location, making sure that the location is accessible. And this is things like ensuring that, say, it's wheelchair accessible, but also sound. So making sure, so for example, we learned something at the dialogue because we had a participant that had a hearing challenge, and so we learned that we needed to always hold the mic so that the person can hear. So making sure that we understand people's needs and making sure that the spaces are physically inclusive for people with disabilities as well. And then another thing is making sure that we accommodate, kind of proactively plan to prevent attrition, because over time, people are going to go back to their organizations, and we want to make sure that we can still sustain that engagement with them. Another learning from this is to align the goal and the content of the dialogue to participants. And it's not just the sector that they come from, but also their position in that sector. So are they frontline workers? Are they managers? Are they policymakers? Wherever they're located within the organization is also critical to making sure that they have the information that they need. And then in line with this is also understanding their outcome expectations. So are they coming to learn? Are they coming to network? Are they coming to move to concrete policy action? Setting those very clear expectations before people show up is going to be helpful to maximize the outcome of deliberations like this. So in terms of our future directions, we were planning to understand how people are using this information after the dialogue. So we have already done some post-dialogue interviews and surveys, and we're going to integrate all of this, and we'll be sharing this information as well. We have also had other dialogues. So we've had a dialogue in Ottawa, and we're planning one in December in Quebec, and we're going to integrate our learnings from all these dialogues as well. And then through these dialogues, we're also going to reflect on things like factors that impact participation, so location, socioeconomic factors, behavioral factors. And we're also planning to validate a tool for knowledge use. So as I said, we had some surveys of participants, and we want to see how they acted on the information. So we're going to be validating a behavioral change tool based on the theory of planned behavior to understand whether or not they acted on the information and what kind of factors like attitude, behavioral, the norms of co-workers and other factors like that influence their ability and whether or not they acted on the information in the short and the long term as well. So this is currently in development. So that's about it, and I look forward to your questions.
Great, thank you, Abele and Keiko, for that presentation. So again, you can send your questions in the chat box to all participants. And just while we're waiting for some questions to come in, I do have a few questions. So what applications do you see for this process, maybe even outside of policy or in other areas of public health?
Hello? Okay. I'll take this. So in terms of the applications, I think it's really understanding when we're talking about engaging stakeholders with public health evidence, understanding that it's a very collaborative process. And if you really want to use this evidence in action, whether or not it's in designing programs, whether or not it's in, say, designing health education programs or building staff capacity, even beyond policy, it's really making sure that the evidence you're using is adapted to the needs and the preferences of the target audience if you want to make sure that you can kind of increase the chance that it's being taken up. And you're not just adapting the evidence to their preferences for receiving the evidence, but also adapting it to their context so that they can reflect on their circumstances and how they can navigate those circumstances to create solutions. So it's really, the lessons are really to make sure that we're making public health solutions context appropriate so that we can ensure their sustainability and their uptake as well.
I'm sorry, I was going to unmute myself and then I hang up by mistake, but I'm sure Abele responded perfectly.
And I have one more question here. So this seems like quite a number of steps to this process, at least to do the systematic review and the policy brief. How long did it take this whole process take?
Right. I don't know, Abele, if you want to take on that, but so we did the rapid review, the whole process. I want to say 6 months. Would that be correct, Abele, in terms of timeline? But we did the prep work before, right? So the work with the stakeholders, identifying the framework, that took a bit longer, and then the prioritization of which items we should do a review on. The rapid review on itself, it took about 6 months to conclude the whole thing, like the search, the data extraction, the triage, and the brief compilation, give or take. Is that that's a recollection of facts about it?
Yes. Yes, so it was thereabout.
Yeah, but it's so the whole between the stakeholder consultations and identifying the documents, the priorities, having the whole that took a good year to do the entire process. The rapid review in itself, being a rapid review, it's meant to be, if you have the staff, the capacity, meaning, librarian lined up to help with the search, the initial search, and a few people doing that extraction. So we had more than one person doing the articles, that extraction and summarizing, and then someone else analyzing and compiling the summaries and the briefs. So if you have enough team on, I guess the review alone you can do in 6 months' time, perhaps a bit less, depending on the scope and the size of the research questions. In this case, we had 3 different questions, so it was a bit bigger than usual rapid review, let's say, because we really had 3 questions on inclusion, access, and capacity building. Each one of those were kind of a separate search. So that was a bit longer than a rapid review would usually take or should usually take.
Great, thank you. And I'd like to open it up now to anybody who has questions for any of our presenters today. I do have one more question for all of you. I hope I'm not putting you on the spot. But would you be willing if we could provide your contact information? I know, Kristen, you have indicated in your casebook story that individuals can contact you if they would like to see some of the resources for the Evaluative Thinking campaign.
Sure, not a problem.
Mm-hmm. That's fine, no problem.
Excellent. So if you would like to contact any of our authors, I believe their emails will be linked in their casebook stories on our website as well. Abel, do you mind just passing me back the ball?
Okay, let me see. Okay, I think I passed it now. Let me know if you got it.
Okay, perfect.
Did you get it? Okay.
Yes, I did. So if there are no more questions, I think we'll wrap up here. So if anybody on the line would like to share your story, we are open to hearing from you and would love to hear from you. So are you using EIDM in your practice? We want to hear about it, and our email address is up on that slide. It's also in the chat box. And if you need support for EIDM or evidence-informed decision-making, we can also help, and we would love to help. So you can also contact us at that nccmt@mcmaster.ca email address. That is also in the chat box. Also, your feedback is very important to us. So we have a short survey that will be available after the webinar. The link is on the slide. It's also in the chat box, and it should open when you close out of your WebEx browser today. Our next webinar in this series will be on November 28th from 1 to 2:30 p.m. And it will feature stories from Niagara Region Public Health and Emergency Services, as well as the Newfoundland and Labrador Centre for Applied Health Research. The registration link is in the chat box. It can also be accessed from our webinars page on our website, as well as through our social media feeds, so Twitter, Facebook, and LinkedIn. There are also several other webinar series available from the NCCMT. So we have a spotlight on methods and tools, topic-specific methods and tools, the online journal club, and the peer-to-peer webinars, which is, of course, this series. So if any of those sound interesting to you, keep an eye out on our social media feeds as well as on our webinars page again. So I'd just like to take this opportunity to again thank Abele, Keiko, and Kristen for your presentations today. They were really informative and really brought your casebook stories to life. So again, thank you. We really appreciate you presenting today. If anyone has any other questions or comments, again, our email address is up there, and we welcome any comments into that email address.